All right, chapter 4 of the senior manual. This would also be chapter, I believe, 7 in, no, that's not right. Actually, yeah, I think chapter 7 in your regular textbook. But either way, it's the fitness assessments chapter. If I am wrong, make sure you read the right one. But as we're looking at it, we are going to be going over some of the contraindications for training, like certain fitness assessments that are kind of a priority for seniors versus the ones that, we're probably going to skip. We're going to use it to help us identify the appropriate exercises, the example I always like to give people is, if you think about whether or not a client has knees cave in or like knees caving out, that's going to depend on like which leg exercises you're going to do. If you've got a client with knees caving out, well, then hip abduction is actually something you're trying to avoid because they do a little bit excessive abduction, whereas like if the knees are caving in, you want to prioritize hip abduction because that's what's going to pull their knees back into neutral alignment. So that's what's really great about fitness assessments. It sort of helps us identify like what the appropriate warm-up exercises are and then what the appropriate strengthening exercises are. So we kind of want to get through all that today, the components for a good fitness assessment, as well as how to administer that, subjective information as well, understanding our posture, and then how to put it all together. So obviously, a fitness assessment is a pretty complicated tool. If we go to NASM's website, actually, we'll go over here and download their assessment forms. You can find these, by the way, available just on NASM's like base website. If you just go down to the trainer resources downloads tab, you'll actually see they've got their assessment forms right down here. And so if I just I'm going to open all of these up here because we're going to kind of go through all of them today. Don't think they go in order, but that's all right. So right off the bat, you can see it's got a lot of paperwork for us to be able to download. That's going to make things pretty easy for us because we want to make sure that we're pretty systematic about this. We want to get a really comprehensive overview of what's going on with our client. And we're not going to be able to do that without the proper forms and stuff. This just makes it very easy for us to write stuff down. Now, I'll be honest with you guys, I actually don't use these forms when I'm assessing my clients, because I kind of find them to be a little bit clunky personally. Instead, I have sort of taken these and kind of made my own, where I've put everything sort of on one big document and all together. What's up, Marjan? Good to see you. But I do think this is a really good place to kind of start off. I think this can be a very valuable tool for you guys when you guys are first starting out. Eventually you're going to find that you need like other stuff that's not going to be found on these forms, and you'll probably end up making your own ones as well. This also doesn't have anything that like your insurance company will eventually give you. You'll want to have those forms for like waivers and things like that your client can sign. But this is a really good example of all of the stuff that can be in a fitness assessment, or this is a very good example of the basics of what you need when you're starting out. So just head over to NASM's website and download those things. They have them. Obviously, they're the same ones that are example versions in your textbook and stuff. But so a fitness assessment, right? If we're just going to go ahead and give this definition before we get started here in looking at them specifically, is a series of exercise assessments that help trainers gather adequate data related to their client in order to create safe and effective programs, right? So the idea here is that you're administering a certain number of tests that you understand how to interpret so that you can figure out like everything there is to know about your client specifically, right? Like how many times have we seen, have you had friends and stuff ask you like, hey, I've had this like ache and pain, like, do you know what I should do about it? Right? Or how many times have we seen even in class where someone's like, hey, I've got this like, back problem or ankle problem, do you know what that might be? And a lot of times I'm like, oh, I don't know, like I'd have to really take a look at your posture and kind of analyze and things. I can't just make like an educated guess without really seeing how you move. That's what an assessment is for. It's meant to be this like time for us to kind of sit down and really analyze and interpret. And so in order to be able to analyze it, in order to be able to interpret, we need to put a certain amount of stress on our clients' bodies, which we're going to do through like movement assessments or cardiovascular assessments. And we're going to see how they respond to that stress. If I make you do like a cardio assessment, like walk a mile, and you absolutely crush it, that's going to tell me that you are in very good cardiovascular shape. And, the types of programs I give you are probably going to be pretty advanced. But if I give you like a posture assessment and, we've got a lot of different postural distortions, well, that's going to tell me a lot about like what exercises I need to prioritize to work on your mobility, what exercises I need to work on to prioritize for your strength, and what muscles I'm really going to spend most of my time dealing with. So we are going to kind of split our fitness assessment process into two major categories. We're going to start with all the paperwork, right? We're going to start with all the subjective information. Now, this is information that we cannot necessarily measure, but it is very valuable because it's going to tell us a lot about our clients' like health history, and it's going to tell us a lot about our clients' like lifestyle, and those things play like a huge role. Like if I ask you, what does your job look like, and you're like, oh, like I work behind a desk all day, right? And then, coming in, you tell me that you are, prioritizing weight loss. And that's like what's really important to you. I'm probably going to draw a connection in my brain. I'm going to be like, oh, so this person has like a very sedentary job and they're trying to like, lose weight, which is why they're seeking out a gym membership. But it's like, that kind of signals to me that this person's going to try to burn like a lot of calories while they're in the gym. Because they don't necessarily do that naturally throughout their day. Versus the person who tells me that maybe they want to drop a couple pounds and, they work in construction. That second example is like, ooh, they already have a very physically active job and they're still struggling with their weight, right? Like there's, something else at play here. So now I'm going to look at maybe what their lifestyle looks like at home, or, maybe what their diet looks like. Because that's a lot of, a lot of times, like that's something people don't realize is how many calories we sort of burn throughout the day, just living our life, or I should say how many calories we don't burn throughout the day living our life, So that's what's nice about subjective information is, the objective stuff is the numbers. It might be the scale weight or, your client's circumference measurements, or it could be their posture, right? And then the subjective information is sort of the why behind all those numbers, So subjective can't necessarily be measured, but it doesn't make it invaluable. And objective is the very measurable information that we can, use and track as things change over time. So with our subjective stuff, we're usually going to use two major questionnaires in order to gather that information. The first one is going to be what's called the PAR-Q. That's your Physical Activity Readiness Questionnaire. You should be doing the PAR-Q with every single client. Now, it's not necessarily a waiver. You definitely want to make sure that you have your clients fill out whatever waivers you have at your gym. Whatever gym you end up working at will walk you through that and tell you how to do that, because everyone's going to have a slightly different one. So we don't have like an example waiver for you guys to look at, or your insurance company will have one. Like if you sign up with like, Next Insurance, for instance, which is the one that like partners with NASM, they've got like they've got their own specific waivers for that, so everybody's going to be, everybody's going to have their own sort of distinct versions of this, right? But the PAR-Q is something that you should definitely all be doing on its own. Okay, so the PAR-Q, this is your Physical Activity Readiness Questionnaire, and we always want to start with this because this is going to tell us whether or not it is even appropriate for us to train our client, whether or not it's even appropriate for us to take them through a fitness assessment, right? If we decide to, put them through a fitness assessment, we just take them straight to the gym floor, and then all of a sudden, I don't know, maybe they have like a heart attack or something, which would be terrible and scary and horrifying, right? If that's something that just like happens out of nowhere, right? And let's say for some reason, this person's family decides to like try to take us to court over the whole situation. One of the things we're gonna have to prove to a judge is that, we did our due diligence and tried our hardest to keep this person safe. Like that's what is going to happen in this hearing. They're going to be like, hey, did you do everything you're supposed to do to try to keep this person safe? And if you just straight up took them up to the gym floor and started making them do burpees or something like that, that doesn't send the message to me that you tried to keep this person safe. That sends the message to me that you tried to kick this person's butt, which, don't get me wrong, like a lot of trainers, like we think that that's what we're hired to do, is to kick people's butt all day, and in some capacity we really are, but not at the expense of anyone's safety. So that's why we always want to start with the PAR-Q. It keeps our client actually safe because it's going to ask them a series of questions all about their health and wellness. And it keeps us like legally protected in some capacity. Obviously not, things can still happen. But it keeps us protected in some legal capacity because it shows that we tried to identify anything that might be wrong with our client in the beginning. Okay, so the PAR-Q is a actually, I've never taken the time to like read this to a class out loud, but let's just read the very top of this here. It says, the health benefits of regular physical activity are clear. More people should engage in physical activity every day of the week. Participating in physical activity is very safe for most people. This questionnaire will tell you whether or not it is necessary for you to seek further advice from your doctor or a qualified exercise professional before becoming physically active. So that line right there at the top says like, look, you should, it's telling you, it's talking to your client there. And it's like, most people, it is safe and healthy to engage in physical activity. But this questionnaire is designed to tell us whether or not you might fall into that category that's not safe, right? So the PAR-Q, the Physical Activity Readiness Questionnaire, is a safety questionnaire that determines if it is safe for a person to engage in physical activity. If your client answers yes to any of the questions on the PAR-Q, they should probably get medical clearance from their doctor before they actually hit the gym floor, okay? So let's say you gave your client the PAR-Q, they filled it out, and then, they're going up the stairs before we even get to the gym floor, and they have a heart attack and they pass away. Horrifying scenario that I've never seen anything remotely close to, or even heard of anything happening like that in all of my years that I've been doing this. But we're making the world's worst scenario here, right? Let's say that's what happens, right? So then all of a sudden you go up in front of a judge and they're like, hey, did you try to keep this person safe? And you show them, it's like, look, I asked them, I had them fill out this medical clearance form, the PAR-Q, and based on what they told me, I had no reason to believe that they couldn't handle going up a flight of stairs. And that judge is going to go, all right, great, cool, we're done here, later. If that was true, that'd be the greatest judge ever. Later. But like, that's basically how it's going to shake out. It's like, look, I did everything in my power. And so like anything that happened is outside my power, which means it's really not my fault. And that's one of the reasons we do this. So you can see these first 7 questions here. They're all questions related to the cardiorespiratory system, because again, cardiovascular health that's why I use the example of like a heart attack. Cardiovascular, health is probably the most dangerous. So it's like, have you had balance or dizziness in the last 12 months, balance problems or dizziness, lose consciousness, any medication from like a medical condition. So if they say no to everything on the PAR-Q, awesome. It took us 10 seconds. We're done with it. They sign right here. We're going to sign our signature as the witness, or we're going to sign as the witness here. And then we're done. We're out of there. We're good to go. Let's hit the gym, right? But if they answer yes to anything, on the PAR-Q, you're going to have them continue on to like this next section down here, right? And it's just going to get much more specific about things, right? So now we'll go into arthritis or back problems. We'll go into different types of cancers. We're just going to get a question about pretty much any disease that might be out there that could be affected by an increase in physical activity. Now, if they still said yes to any of those follow-up questions, they should seek further medical information from like a qualified medical professional before engaging in physical activity. But if they still want to, participate in the activity today, they can sign this second questionnaire down here, or they can sign this second declaration down here, which says like, hey, I understand the questionnaire. I understand that I am taking my health in my own hands. Now, if they did answer all that, this also gives you an opportunity to say, you know what, I'm not really comfortable training you. Personally, if it were me, I wouldn't do that. I'd say, great, all right, we've got all the information, written down and filled. I'm legally protected. You're declaring that even though this is risky, you're going to engage in it. Cool, we're good to go. I would still train that person personally, if I get them to sign that second section. But that is what the participant declaration is for. It is meant to be a second opportunity for the client to see, hey, exercise can be intense. And so like, I'm choosing to engage in this, right? And that's what that second section is. So there's your PAR-Q. And that's how that works. Like I said, this is the first thing you should be doing with every single fitness assessment. You always want to start with the PAR-Q because like, the first thing you want to do is protect yourself and your client from anything, right? So if they say yes to anything, you can always refer them to a medical professional for further screening before actually engaging in any physical program. The next part of the subjective stuff, and this is all happening at the desk, right? So first things first, you walk through the, your client walks through the door, you greet them and say like, hey, I'm going to be your trainer today. Let's take you over to the area here and have you fill out some paperwork before we get started. So the first thing you do is you have them fill out the PAR-Q. Now you are both sort of like protected. And now we're going to do the rest of our subjective information. They're still sitting down. And we're going to have them fill out the lifestyle and health history questionnaire, right? Or sometimes it's called the general or medical health history questionnaire. This is going to be general information about your client's like medical history, any medications they might be taking, their hobbies, things like that. Subjective information that I want to know about my client, even if it doesn't necessarily directly have to do with what's going on in the gym today. Because again, the stuff you're going to find out in this general medical questionnaire is the kind of stuff that tells you the why behind the what, right? Their what might be that they have an anterior pelvic tilt. Their what might be that they can bench only 45 pounds. Their what might be that they have really poor cardiorespiratory conditioning. But the why behind all those things is probably going to be found right out the gate in their general questionnaire, right? A little bit of information about their background. Okay, so it's general information on what their likes, their dislikes are. If I find that like they're really struggling physically, and then I ask them like what, how often they engage in exercise, and they're like, never. And then they say, it's like, oh, what are your hobbies? And they're like, video games, like, and it's like, okay, I'm starting to see like some sedentary patterns here, right? Again, it's the why behind the what. So it's a comprehensive medical history questionnaire. A lot of the information is very medical. Tells you a little bit about like any injuries they might have, any prescription medications they might have, but it also tells you a little bit about like what their hobbies are, so let's take a look at this right here, right? Obviously it's got the contact information at the top. We can move past that, but looking, first section, we're just going to ask some questions about exercise. Like, what activities do you currently partake in? Do you like running? Do you like, weightlifting or group exercise classes? We're going to have them list that out. And if they tell me, they're like, oh yeah, I go to spin class twice a week. Great. What do I know about that person right out the gate? They like spinning. So when I write them a cardio program, chances are I'm going to incorporate a spin bike. Or maybe I'll take the exact opposite approach. I'm going to prioritize getting on a rowing machine because it's different than a spin bike. And I'm going to tell them like, hey, I put you on the rowing machine. I know you like spinning, but I think that rowing actually might have some similar benefits, and it might feel similar to like a spin class because you can go fast, you can go slow, you can vary your intensity. And I think this is an opportunity for you to try something that you're not so good at, right? Or I take the opposite approach. It's going to depend on the client, right? I need to get through the rest of this assessment before I make decisions like that. How many days a week do you get at least 60 minutes of moderate intensity activity? If my client tells me that it's a bagel, they get no time to exercise per week, right? Well, that's going to tell me that chances are this person's pretty deconditioned, and I should probably prioritize just getting them up and getting them moving. I like this section here. It says on a scale of 0 to 10, how important are the following goals? Weight loss, muscle gain, sports performance, health improvement, right? That's going to do a good job of like telling me, where their priorities are. And it makes it kind of number based, which is nice, and that way, like, I understand a little bit about like where my client's coming from. We got some questions about diet here because obviously we are nutrition experts as well. On a scale of 0 to 10, I like this first one right out the gate. It's like, how do you consider your overall diet to be healthy? And it's like, what do they think, right? I would love it if my client gives me like a 10, and then we get like further down the line and we start to see like, oh, that's not such a healthy decision. Oh, that's not such a healthy decision. Now I'm probably going to understand that they don't have a very good background in nutrition. That's okay, because now I can make adjustments, right? What's up, Danny? Question.
Yeah, and the part of the in this questionnaire, it's fine. Is we ask the person if they use any kind of drugs, like if they smoke, they smoke marijuana or 100%. Just tobacco or something like that.
Yeah, so it doesn't have marijuana on here in particular. Where is it? I think that's actually I think that's in diet here. Hold on. Actually, maybe not. No, there it is. Do you smoke tobacco or vaporize? It's in lifestyle. We do have a question about that. Absolutely, though. If you want to like add that in, I'll often ask that for sure, especially nowadays, as like marijuana usage becomes like, it's legalized and easier access. Like, people are much more willing to like talk about stuff like that. I definitely want to know about that, because don't get me wrong, like we've talked about this very briefly. I never have like a place to get to talk about recreational drug use or anything. But like I think that there are plenty of health benefits to like cannabis in general. I personally don't really have like a lot of experience goofing around with that stuff, I remember one time I took like a really bad hit at Ultimate. This guy like slammed into me and like I threw out my back, and I had like a big old bruise, and my roommate, who like loves cannabis, was like, oh, you got to do CBD. And that's about as much as I've ever goofed around with the stuff. And I remember being like, well, I'm never using that again because it smelled terrible. And he was, I didn't want to hurt his feelings, but I was like, whoo, I do not like this. But I will be the first to admit that like that stuff has some positive pain benefits. I think that like it can be very good, obviously, for fighting like cancer or dealing with like nausea during like chemotherapy and things like that. Big fan of it in a lot of ways. However, I will definitely ask about it, because one of the drawbacks to marijuana usage, whether it's through vaporizing or smoking, is that it's very bad for your cardio. We know that it just clogs up the lungs. It's particles, right? It's not about the fact that like because a lot of times when I say that, sometimes people get a little defensive and they're like, no, it's very good for, the people with lung cancer will often like, use marijuana to like, during the treatment. because it has like cancer fighting properties. Yeah, 100%. But they shouldn't be smoking it, like, so like I'll ask for sure because I want to know if they're putting particles of stuff in their lungs, that's my take on it personally. NASM doesn't really address it. But me 100%, like, and I've been asking for 10 years at this point, if that answers your question.
Yes, thank you.
Yeah, I honestly, I would love it. They put one in here. They should ask like, hey, do you go camping very often? Like, do you have a lot of backyard bonfires? Because if you do, like, guess what? That's got particles in it, and I kind of want to know about it. I think it would have to be a lot, but still, like, I think it, I just want to know if there's gunk in my client's lungs. Yeah, so we're in the exercise section. So how many days a week we're asking our client, do they get 60 minutes? Is it a lot? What goals are important to them? I want to know a little bit about their diet, right? Do they just in general consider their diet to be healthy? Honestly, guys, I think this right here, this question, in my opinion, is probably one of the most valuable on this entire questionnaire, because it's a really good opportunity for me to see what my client's perception of their diet is. And then as I get to know them, if I find out that, like, they're making a lot of maybe unhealthy dietary choices, or like they get a lot of junk food in there, it's like little things like that. And so I'm going to be like, this person told me that they think their diet's really healthy, but none of these things sound healthy to me. And then let's say I'm working with them for, 6 weeks, 8 weeks, whatever, right? I've been working with them for a while. And maybe they have this day where they're like, oh, they're kind of frustrated. And it's like, man, I've been on this diet and it's just not, I'm doing everything that I'm supposed to do, and I'm still not losing weight, right? And they're all frustrated. And I'm hearing all this and I'm going, you think, I believe that this person believes they're doing everything they're supposed to do. You know what I mean? Right? Like now it's like, okay, their perception of how many calories they're eating every day could be a little bit off. This person might need a little bit of coaching when it comes to like learning portion control, right? Like, what does 4 ounces of a chicken breast actually look like? I remember going for quite a while, thinking, because I had like heard this from one of my teachers, and I think I've either misheard it or just misinterpreted, or maybe my teacher was just straight up wrong. But I remember being told like the size of a chicken breast is about the size of your hand, with like closed fingers. The size of a chicken breast, sorry, 4 ounces of a chicken breast is about the size of like your palm, like your hand. And that is not true. A chicken breast, 4 ounces of a chicken breast is about the size of your palm with your fingers cut off. That's actually much more accurate. And that was just a misconception that I had. So if I had been coaching people, using that, their perception of how many, calories and stuff, it's going to be wrong, right? So again, the questionnaire is kind of bailing us out here because we're learning a little bit about our client right out the gate. So we ask them if they're on any kind of diet personally, right? And then we ask them maybe, I love that this is like, if so, for what reasons? I think that's a great question. So, right, tell me if you're on keto. Let me know if you're on if you do intermittent fasting. Let me know if you're on Atkins. Let me know if you're doing the grapefruit diet from back in the day. Please don't do the grapefruit diet from back in the day. That is terrible. But like little things like that. I want to know about it, right? And then I like the if so, what reasons? Like then we can get to the motivation behind this, right? How would you rate your salt intake? Is it high, medium, low? Sugar intake, fat intake, right? 3 areas that can sometimes be problematic. If my client tells me they've got super high sodium intake, and then later I find out that they have like hypertension problems, we can draw a connection there. How effectively do you feel like you control your temptations around junk food? On a scale of 0 to 10. Me personally, guys, like, when it comes to like junk food, I would put my own self-control at around like a 5. I'm not that great around junk food. I like if it's around, I'm probably gonna, partake. It's one of the reasons why my girlfriend and I, like, we're talking about this the other day. We shop very differently, she and I, she likes to have like snacks in the house. for like when we're watching movies and stuff, and like we sit down. And I'm not saying like you should avoid junk food for the rest of your life 100% of the time. I think that it's a treat that you should, absolutely partake in, when you're celebrating and when you're having a special night and things like that. I have not, like, I think there's room in our diets, guys, for junk food. There is, it's a controversial opinion for a trainer to have, but I think that there is room for it. However, I don't like bringing it into my house. I don't like having it just like around passively, we had a party the other day, and like somebody bought like a giant thing of M&Ms. And like we only went through so much of it. So now there's just a giant thing of M&Ms downstairs. And luckily that's not one of my favorite like candies. And so like I don't have such a hard time controlling myself around that. But if that thing was like Reese's Pieces or something, I'd be all over it, like that is in one of my favorite like junk foods. So for me, like I know that like I like to, if we're gonna have like a movie night or something, generally like the approach that I like to take is be like, all right, give me 10 minutes, and I leave and I go down to 7-Eleven and I get like a candy bar or something and a bag of popcorn, and I come back and whip those up right before watching that movie, rather than keeping it in my house passively. So if I have a client who tells me that they do not effectively control themselves around like junk food, that's good. That's good information for me to have. Maybe I can share some of those tips and tricks to help them gain that control, because I don't really consider myself to be that great at it. If it's around, how many alcoholic drinks do you consume per week? We definitely want to know about that, because alcohol is, again, there's also room for that in our lifestyle, even though for the most part, it's pretty much irredeemable. I know that like, we've all heard that statistic where it's like, no, you're supposed to have a glass of wine at dinner every night. So it's been shown to reduce heart disease. That is a study that was done. The more they have looked at that, though, the more they've realized that the reason people who have a glass of wine every night do not have heart disease has nothing to do with the wine and everything to do with the personality type associated with it. If you are somebody who knows how to relax, you are less at risk for heart disease. So it really has nothing to do with the wine, unfortunately. What about caffeinated beverages? We want to know about how many times, if our client's drinking like 4 Monster Energies every day, I want to know about it. Lifestyle, do we feel like our client gets enough sleep every day? On a scale of 0 to 10, how would you rate your stress? What techniques do you use to manage your stress? And then there's the, do you smoke tobacco or vaporize? Or if we want to ask our client about cannabis, we can. So any of those lifestyle questions are going to kind of give us a clearer idea of like what our client's day-to-day looks like. If they're very stressed, that could obviously lead to all kinds of problems. If they do not get enough sleep, that causes stress, which can lead to all kinds of problems. So we're just trying to get to the heart of that. And then we got some questions about occupation here, which seems kind of weird. You wouldn't think that occupation would have much to do with being in the gym, but guess what? It absolutely does if they have a very stressful job, right? I know that that's going to lead to tension and things like that. If we ask them if their job has extended periods of sitting, it's kind of a weird one, right? But the idea here is if they're sitting all day, I know that chances are their hip flexors are going to be a little tight. If they're sitting all day, chances are they're not burning very many calories. So both of those things are kind of highlighted through that question. Does it require repetitive movements? Well, if it does, then chances are the muscles that facilitate that movement are going to get a little tight. Painters, for instance, right, will often have really tight rotator cuffs, or construction workers. Does your occupation require you to wear a shoe with a heel? Seems kind of a weird one, but again, if they're elevating their heel all day, well, then they're in plantar flexion, and their gastrocnemius, which facilitates plantar flexion, right, is probably pretty tight because it's in a shortened, contracted position all day, thanks to the shoe, So I want to know about it. Recreation, I love this one because it's a good chance for you to get something, this is something you might be able to talk to your client about, We ask our client if they engage in any recreational physical activities, like maybe they play in a softball league or something like that. That's great. I can learn a little bit about it, and then we can talk about maybe they're a baseball fan and we can chat, and talk shop, or any additional hobbies, right? Maybe they like going fishing. And now I've got some conversation topics to bond with my client on during our training session, which is also a very valuable part of training our client. And then we get into the medical section, which, if we're talking about seniors, this mod is probably going to be pretty relevant to us, right? We want to have them list out any injuries that they've had, sprained ankles in the past, broken bones, surgeries, right? Injuries that they didn't necessarily heal from very well, or maybe they need like proper clearance from their doctor. We want to know a little bit about like any of the medical stuff that they are sort of going through. Let's ask them if they have any chronic health conditions like cardiovascular disease or hypertension, diabetes, if they're in remission. We want to know a little bit about like any of those diseases, because our next question, are they on any medications? And we want to maybe know about those medications, because those medications could artificially affect their heart rate, or their breathing rate, even blood pressure, right? It can have certain physiologic effects that I want to look out for during my workout. If they tell me they're on a beta blocker, which lowers heart rate and lowers blood pressure, and then I go give them like a cardio assessment, and all of a sudden they crush it, they're over there like breathing their butt off, but their heart rate's like kind of low. Like I'm like, hey, you scored super high, I'm gonna make you do some wind sprints next time I work with it. Probably not a very good interpretation of my fitness assessment data, so I want to make sure I pay attention to that. And then it's a chance for us to add any additional notes about our client, so we can just know about our client moving forward. When I write this routine, if I have additional notes and my client says, I hate with all my heart running, like if I find that out, well, then chances are I shouldn't be putting my client on the treadmill when I write their routines. So as we're going through all this, you might notice that this is like I said, this is a questionnaire. There's a lot of questions. So it's very important that we sort of take this time and recognize the fact that we are interviewing our client. Now, you could, and I see trainers do this all the time, send your client all this information beforehand. You could email them their medical history. You could email them this general questionnaire and have them fill that out before you get to the gym, or email it back to you the day before you even meet them. And you can sort of take a look at all this information and analyze it and interpret it. And that's fine. I think that you can totally do that. The advantage is, guess what? Your session, you don't have to spend any of your time doing that the day they show up. You can just dive right in. That's an advantage for sure. Saves a lot of time. However, me personally, I don't like to give my client the questionnaire and then just have them fill it out. I like to interview them and ask them these questions, and I like to write down their responses, because when you interview somebody, it often reveals the important information that is between the lines. You know what I mean? It's a good opportunity for you to clarify things much further, right? So I can't do that if they are just straight up, if they're just straight up filling out a questionnaire, right? This gives me an opportunity to learn more when I actually ask them questions. So it helps me identify which activities are enjoyable. It helps me construct a program that's going to, my client's going to like, because I'm getting an opportunity to actually ask them further, deeper versions of things. So if I say something like, have you ever had any surgeries? And then I clarify by saying like, not like an appendix removal or, like dental surgery or anything, but if you ever had any surgeries on like, your rotator cuff or knees or anything like that, right? That clarified the question. And so I kept it focused on exercise. And it gives me an opportunity to also, like if I'm interviewing, remember yesterday we talked about this idea of building rapport with our clients. How do we do that? Well, we build rapport through active listening, right? So interviewing them is a good way to actually do that, to actually, listen to them, ask them questions so we can get a response. So that's our subjective information. Any questions on how that works, guys? Any questions on that questionnaire? All righty. Well, let's take a look at the objective information, right? So objective information, this is where we're going to spend most of our time during the assessment, but this is very much like numerical data. This is like the number-based stuff, right? Let's take a look at like, let's see, a YMCA step test, right? So the YMCA step test is a cardio assessment. We're going to be taking a look at this here in just a minute, but let's say you give your client the YMCA step test, and we've got numerical data. We know what their age is, for instance. We look over here. Actually, I think that's on the lifestyle questionnaire, actually. Yeah, but that is still objective data. So I gather that number, and then I put them through the step test, right? I go over here, and we'll walk through how to do this in just a second, but and I record it, and their heart rate is 113, right? So their heart rate's 113, and then I look at my client's age, and they are 67 years old, and they're female, right? So I go over here, and I look at the female, and I go, okay, they're 67, so that puts them in this category right over here, and their heart rate was 113. That's going to put them somewhere between average and above average. So then I go back over here, and I have that 113 written down, and I'm going to circle, maybe right in between these two. Well, guess what? That means that, like, I can actually give them a relatively intense cardiorespiratory routine in this example, right? They're in pretty darn good cardiovascular shape. So my program that I write for them can reflect that. So that's what's great about our measurable data. It does give us sort of numbers to pay attention to, numbers that we can track and improve over time. Let's say my client's heart rate recovery was, 140, right? Well, that puts them all the way down here in the very poor category. So now I would mark that, as very poor. They did not do great. So I'm going to be pretty gentle in my cardiorespiratory routine for this client. But now I've also got something that I'm probably going to prioritize. All the programs I write are probably going to emphasize cardio so we can get better at that over time. We love numerical data because it is easy to track, it's easy to see improvements, and it does have sort of a direct correlation to what things mean. First one, but we are going to see a lot of different categories here. We're going to see physiologic assessments, body composition, cardio, posture. And for seniors, we're going to put some emphasis on what we call a fall risk assessment and make sure that our client is not a falling risk. This is sort of replacing the traditional approach to assessments, which would be performance assessments, would be our last category. This is a performance assessment. It's just a performance assessment for, a senior client. So the first one we're going to look at is going to be our physiologic assessments. Number one thing we're going to take a look at here is the heart rates. Now, there are various types of heart rates, and they are going to mean different things depending on what we are using them for. So the first one we're going to take a look at is the resting heart rate. So when we're looking at like heart rates, right? And I'm just going to kind of make a big category here so you guys can kind of follow along with this. So when we are covering heart rates, there are a lot of ways that we use heart rates as trainers. The first one that we're going to look at is the resting heart rate, right? So this is going to be an individual's heart rate when they are completely at rest. Now, I know that if someone's heart rate is low when they are at rest, that they're probably in pretty good shape, right? Their heart is able to pump blood around the body and stabilize. without very much effort, right? It's able to get the same amount of blood pumped around the body in less beats. That's an efficient heart. So one of the easiest things to look for in health is just a low resting heart rate, right? The lower someone's heart rate is at rest, chances are the more efficient their heart is, right? And we know that because of our understanding of what we call cardiac output. We talked a little bit about cardiac output in the past, but this is the overall performance of your heart, okay? And it's going to be your heart rate, the number of beats the number of times that it beats in a minute, times the stroke volume. Now, the stroke volume is how much blood is ejected from the heart every beat, which we can't know. You know, we don't have the sophisticated equipment in a gym to be able to calculate someone's stroke volume, but we can draw some conclusions on the performance of their heart by looking at the heart rate, because we know that heart rate and stroke volume are tied together. If I look at this cardiac output, like I said, the overall performance of the heart, like I said, it is going to be their heart rate times their stroke volume. So the formula for this, hold on. The formula for this is going to be heart rate times stroke volume equals cardiac output, right? So if my heart rate, if my stroke volume is really low, my heart has to beat more often to get the same volume of blood ejected from the heart per minute. So it has to like make up for that by beating faster. So this is a really great way for us to kind of tell a little bit about how someone's heart is performing simply by looking at the heart rate. Because if the heart rate's low, then the stroke volume must be high. That's a good cardiac output. If their heart rate's high, then the stroke volume is low. That's not such a good cardiac output. So we're just going to kind of pay attention to that. Typically, we want to use this when we are just kind of taking a look at how our client is performing in general. So the first one you want to gather is the resting heart rate, okay? We want to know about this right out the gate. Now, here's the thing. The resting heart rate needs to be measured at rest. Shocker, I know, it's surprising. But here, and that can sometimes be very difficult in a gym setting. So lucky for you, you've been doing this interview and your client's been sitting across a desk from you. So when you wrap up your PAR-Q, when you wrap up your general medical history questionnaire, you want to explain to your client where you're headed next. You're going to say, all right, so we're going to go ahead and head over and do some fitness assessments that are going to give me some numerical data. But before we do, I need to know a little bit about your cardiorespiratory system. So stay seated, but I'm going to come around the desk and I'm going to gather your resting heart rate. So just go ahead and breathe normally for me, and we're going to go ahead and figure out what your heart rate is while it's at rest. So the way I'm going to do this, typically, NASM is going to recommend that you use the radial pulse. That's going to be in line with the thumb and index finger on the left arm, and you're going to reach over and you're going to use two fingers just above the wrist in line with those two fingers there. And if you press, you can probably feel your pulse. Sometimes you'll have to go a little bit higher. For me, it's actually honestly right where my watch is, which is kind of funny. But basically, if I go like right there, you know, I can feel my pulse, right? Everybody's a little bit different. You know, you might have to move things around a little bit. If you have trouble, sometimes you can even find it down here in the palm. You can actually kind of see my blood vessel that runs through there. And if you're still having trouble with that, you can always use the carotid pulse as well. NASM doesn't recommend that one as often, simply because, like, you know, this is a stranger and you're asking to like touch their neck. It's just a little, you know, a little too familiar. But if you're having trouble, just explain to your client that, hey, like this is going to be easier for me to sense. And if you do that, also two fingers just off to the side of the trachea there. So once we measure that, you know, you can, and there's a lot of different ways you can do this, but you're trying to get the number in 60 seconds. Me personally, if I'm doing a resting heart rate, I just do a full 60-second count. I want to make sure this is as accurate as possible. NASM is going to recommend you do it for 30 seconds and multiply it by 2, or 15 seconds and multiply it by 4. Whatever it happens to be, you just need to get it to equal 60 seconds. 10 seconds multiplied by 6. I'm not sure why you would do that one. 6 seconds multiplied by 10. That one's really easy. Oftentimes we use 6 seconds multiplied by 10 if we're in the middle of a workout and they don't have like a heart rate monitor. That's a really helpful one because all you have to do is add a 0. So if it's like boom, 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 and you count 13, beats in 10 seconds, or I'm sorry, in 6 seconds, great. Add a 0 to that, heart rate's 130, because it's 60 seconds is the number we're trying to get to. Me personally, I do a full 60 seconds because again, my clients sometimes might get nervous at like a stranger coming around to like check their pulse. So if I do it for a full 60 seconds, it gives them time to kind of relax and calm down in that 60 seconds because we're just sitting there quietly and they're just breathing normally. So me personally, that's the version I like. But either way, you're gonna get that number and you're gonna go right up here and punch it in to their resting heart rate. Next one we're gonna do is we're gonna calculate out their heart rate max. Now remember, their heart rate max is a general calculation of their upper heart rate based on their age, right? So heart rate max is very simple. It's just 220 minus their age, okay? That's our formula there, 220 minus their age. So for example, let's say I've got a 65-year-old client. Well, then I'm just going to go 220 minus 65 for a max heart rate of 155. Now, why did I do that? Why do I need to calculate out this max number? Am I trying to hit that number? No, not necessarily, right? I just want to know that number so that I can have them work at a specific percentage of that number, right? Remember earlier I said if my client is like average to above average, I can give them a pretty hard routine. I might take them all the way up to NASM's zone 2, which is 76 to 85% of their heart rate. So if I know that my client's 65, 220 minus 65, that's a max heart rate of 155. So if I multiply that by that intensity of anywhere from like 76 to 85%, let's say 80%, it's right in the middle. So I go times like 80%. That means that my target heart rate, I would say, all right, Bob, I'm going to have you at a heart rate of around 124. Hop on that treadmill. Let's get the heart rate to 124. We're going to stay there for a little while, right? And there we go. I used my heart rate max formula to calculate my target heart rate, which is the heart rate I'm trying to hit with my client. Now, here's the problem with the heart rate max formula and using it to calculate target heart rate, right? So actually, no, let me put that definition in our little thing that we're making here. So can be used to calculate target heart rate. Okay, so target heart rate is the next thing we're going to look at. And target heart rate is a percentage of heart rate max that a trainer will prescribe to a client in order to target specific physiologic adaptations. Right? So I'm going to use my target heart rate to make sure that my client is working at a very specific intensity in order to get the right physiologic response. If my client is trying to build up their endurance, I shouldn't be having them work at a high percentage of heart rate max. I should have them be working at a low percentage of heart rate max so that they can go for an extended duration. If I go too high, they're not going to be able to go for very long. That's not going to help me build endurance, right? That is what that is going to be used for, right? So here's the thing. My heart rate max formula is pretty good. If I've got nothing else, it's not bad, right? I can go over here and I can say, okay, heart rate max was, in our case, was 155, right? Or right? What was it? Yeah, 155. But that's not always the most effective, right? That's not always the best way to calculate that, because it assumes that every 65-year-old person on the planet is in the same shape. And that's simply not true. Some people are in better shape, some people are in worse shape, right? So instead, we're going to use the heart rate reserve method, which is an individual's target heart rate. So the heart rate reserve method is not replacing the heart rate max. This is strictly used for target heart rate, based on the difference between their resting heart rate, which is what their heart rate is at rest, and their max heart rate, which is that 220 minus their age. So we're going to use the heart rate reserve method here as a method for calculating target heart rate, okay? And the way we're going to use this is we're going to use a formula called the Carbonin formula, okay? And the Carbonin formula is basically this. It is target heart rate, it equals heart rate max minus heart rate rest times the desired intensity. In the case I used, it was 0.8, 80%, plus heart rate rest back at the end. So we take our client from before, and it was 155 times 0.8. Their target heart rate was 124. But again, the problem with that formula is that it assumes every 65-year-old client needs the same workout. So now let's take a different example. Let's say my 65-year-old client's resting heart rate is 73 beats per minute. So I'm going to take their target heart rate and figure it out using this formula here. Heart rate max minus heart rate rest. So I said their heart rate rest was 73 beats per minute. So 155, because remember, 220 minus their age, it was 155, right? So 155 minus 73, and now I get the number 82. Now I'm going to take 82 and multiply that by the desired intensity of 80%. And then I just need to add my resting heart rate back on at the end. So add on that 73. So now, because my client's in pretty decent shape, their target heart rate's not 124, it's 139. That's way better, right? That means I can push my client specifically cater to them, right? Now, you don't have to do all this math. We got the formula here if you ever do want to do the math, right? Here's a 65-year-old client with a resting heart rate of 70 beats per minute, right? So 155, because that's 220 minus 65, minus 70 beats per minute times, in this case, 65% instead of 80%. And then we add the 70 back on at the end. Because we took it out, we have to put it back in after we're done. You don't have to do all this math. Honestly, guys, there's calculators out there. You can get on the App Store right now. You can download NASM's app, actually, and it'll do it for you. But you can get on the App Store, or you can even just Google Carbonin calculator. And literally the second link right here, we got a 65-year-old client with a resting heart rate of 73 beats per minute. I hit calculate, and I go down here, and there's my numbers, right? There's that 80% I talked about, 139, right? 138.6. What if I wanted to be 65%? Great, 126. What if I wanted to be 90%? Great, 147. It'll do all the math for you. You don't need to know how to do this math, but you do need to know, because they'll ask you, either, and this is what's kind of frustrating, because I don't know which one they're going to call it on your test. They switch it frequently. They don't have any consistency here, but they're either going to ask you, they'll say, blank is an individual's target heart rate based on the difference between their max heart rate and their resting heart rate. So you might get a question like that. Blank is, and then they'll give you the definition. So you need to know the definition. And that definition will either be the heart rate reserve, or it'll say the Carbonin formula. I don't know which one they'll test you on. They are the same thing. The Carbonin formula is the heart rate reserve. I'm sorry for that. I hate it when they do stuff like that. But they'll never put both of them as options. So you'll only see one or the other. It's not like it'll be like A is heart rate max formula, B is Davis's law, C is Carbonin formula, D is heart rate reserve. That would be, they won't do that. And then you have to just guess between the two. That won't happen. But they could put either option as the right answer, because both of them are. So that will help us determine our target heart rate zones, right? That's how we're going to get our target heart rate, is using this heart rate reserve method. And then lastly, we got our blood pressure assessments, right? We do probably want to, have a blood pressure cuff at the gym. I know there's one in your bags. Those are the manual ones. I hate those. I've been saying this for years now. We need to replace those things. You can get one for 20 bucks online and it's electric. Like, look. Okay, that one's 30 bucks. But seriously, they have $20 ones. I've seen them. I wouldn't recommend getting the wrist ones. I really don't like those wrist ones. I like the upper arm ones. But you can get them at CVS for like 30 bucks. Just replace the one in your bag with that. It's way better. You don't have to do it with every client. If your client tells you they've got normal blood pressure and they just had a checkup, you can skip it, honestly. But it is it's valuable information, especially if your client has hypertension, So any questions on the physiologic assessments? Any questions on how those formulas work? Any questions on that, guys? How's everybody feel about all that? I know the math stuff, sometimes I like lose people. Everybody still awake? All right.
I was at first, and then
Still awake.
Yeah. You're feeling good, Danny? Cyrus?
Just the math thing.
Yeah. The math stuff honestly can be a pain in the butt, but there's just get a calculator. Literally just download. Like, watch. I'll get on. I don't have one on my phone because I just use. Well, I do have one on my phone. I use NASM's thing that they have. But if I just Google Carbonite, 5 results right off the bat. Or if I always try heart rate reserve. Yep, there's another. Actually, there's way more that way. Or if I could even probably just try target heart rate calculator. Now that one. Aha, yeah. Target heart rate calculator, even that one. I didn't even have to look up Carbonite or heart rate reserve. First result uses the resting heart rate. So, it'll do the math for you. Okay, so next one we got to look at, we have clients who are maybe going to have like weight loss goals or, weight gain goals or body composition change goals, right? So we need to know a little bit about how to assess for body composition at a baseline so that we can look for changes as we continue training our clients. So body composition and body fat testing with our senior clients, and that's going to be right over here. You're probably not going to use skin fold measurements. So if you're trying to get like body composition, which is like body fat percentage, you're probably not going to use skin fold measurements for a couple different reasons. Number one, as we get older, our skin gets a little bit thinner, which means that, we develop some wrinkles. And unfortunately, the way skin fold testing works is you need to pinch the skin like this, and then you're going to pinch like the subdermal fat there, right? So skin fold testing works like this. We look at the way this works. Oh, sorry, not subdermal, subcutaneous. Oh, come on, internet. Give me the freaking picture. I've pulled it up before. These are all good examples of like what you're going to do. And I'll show you that in a second, but I'm trying to find. So it works like this. Actually, you kind of can't. Oh, that's so close to the picture I need. I can't believe that. I can't find the photo I need. All right, I could spend all day Googling. Oh, that's really close. There it is, actually. Never mind. I found it right at the end. Okay. So see this right here? This is how skin fold testing works. So what you do is you pinch your client's skin, you get a little like fold, right? Like this. And then you use the caliper. And what you're doing is you're actually grabbing, you can see, here's a layer of their skin, and there's a layer of their body fat. So the larger the pinch, the more body fat there is. And so we've got a big fancy formula that we're going to use to sort of calculate that using this sort of pinch method. So the one that I like to use for skin fold testing is going to be what's called the Durnan-Wamersley formula. It's a 4-site method. I find it to be the easiest to use, and it's plenty accurate. So it's 4 sites. It's biceps. So you do a vertical pinch, meaning that you get like a vertical fold like this, right, in line with the arm, right? So if I'm here, right, I would pinch like that, right? And I do the triceps, which is also a vertical pinch like that. I do the subscapular. This one's hard for me to show, but basically it would be like right about here. Now that one's a 45-degree pinch. So basically I go at a 45-degree angle like this, and I pinch like that. So it makes the opposite 45 degrees, right? So if my scapula is here, I basically pinch it like that, okay? And then iliac crest. So I go just above the pelvis here, right? That little bone, right? And I just get a little 45-degree pinch right there as well. So those are the 4 sites that we are going to measure. And we'll practice this when we meet up in person. We're going to practice this next mod, actually. So in about 3 weeks, I would say. And then what we'll do is we go, let's see here, Durnan-Wamersley. So it's a 4-site method, right? So these are the 4 sites that you're going to use. And you're just going to measure using your caliper how many millimeters that is, okay? And you're going to mark them all down. Now, when you're doing this, you need to make sure you do not do it the wrong way, which I will see a million examples of when I Google, right? This is the wrong way to do this. You do not grab the caliper and then pinch the client directly. Wrong. 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 Not only are those in the wrong spots, they are also just grabbing the body directly, which means that you are not getting an accurate readout. What you need to do is grab the skin, and then you are pinching whatever you grabbed. So you are separating a fold from the body and then pinching that fold. This is also wrong, but for different reasons. She's going flat. Again, this should be at a 45-degree angle. She's in the right spot. But again, that's she's doing a horizontal fold. Man, the internet is just terrible at this. This guy's at the right angle, but just pinching directly. Anyway, wrong, too high. Million different ways to kind of do this. But you're gonna basically get it in those 4 sites at those angles. And let me see, let me go back to that picture here. So this picture is very accurate, right? See that right there? 45-degree fold, right? Right there, 45, I mean, that's not perfect in 45, but it's pretty decent, right? 45-degree fold. And then 90 degrees, 90 degrees. So that's the 4-site method. And all you're gonna do is you're just gonna write all 4 of those numbers down, punch them all in. Very, very simple, right? So that's the subscapular, biceps, triceps, and suprailiac. You just write those down, and then it's got a space here for the protocol. There's other protocols out there. There's the Jackson Pollock. There's what are the other ones? I don't even know. There's other methods out there. This is the one I like to use because it's fast and it's just as accurate. So you write those all down and then total up the number. So just like put the sum of how many measurements you've got there, go into your textbook and you're going to look at a little chart and it will tell you what their body fat percentage is based on their age and the sum of those folds all added together. Okay, that's what? That is not what I clicked. You can see that was weird. So if my client is like a male who's like 45 years old, right, and their skin folds came out to 82, right? So I'd be somewhere between 80 and 85. They're 45 years old, so they're over here. That gives me a body fat percentage of around 31.2%, maybe between 32.1. So somewhere between 31 and 32. That's how that works. Now, we probably aren't going to do that with seniors, honestly. Skin fold caliper testing, not very effective for senior clients because of the age. Also, they bruise much more easily, so not really recommended to pinch them. So we don't really use that on that population. Chances are what you're going to use instead is bioelectric impedance. This is going to measure body fat by using a little body fat analyzer that's going to run an electric current through the body. If that current travels really quickly, it says that the body fat percentage is low. If that current travels really slowly, it tells us that that body fat percentage is actually high. So that's probably the type of body composition that we will actually use. It's also the most convenient. It's in most gyms. Have your client hold it, hit the start button. It'll tell you what their body fat percentage is. If you ever get into it, you can also do hydrostatic weighing, which is arguably the most accurate. But unfortunately, it involves like getting into a pool of water. So it's not exactly the most convenient. But in terms of accuracy, this is definitely the most accurate. And basically, we know how much body fat weighs on land and we know how much body fat weighs underwater. And so when you weigh somebody on land and then you throw them in water and you measure the difference between those two, it will tell you exactly how many pounds of fat they have on their body. Super, super accurate, super, super inconvenient. So probably not the type that we're going to end up doing in most gyms. So that's going to tell us their body fat percentage. Next one we're going to look at is circumference measurements. So circumference measurements, which you can see here on the chart as well, is just literally a measurement of their circumference. You know, we're going to measure different body parts. As their body changes, we're going to measure, do those numbers go up? Do those numbers go down? You know, the idea here is that you are measuring body girth, right? Typically, NASM is going to recommend the neck, chest, waist, hips, thighs, calves, and upper arm. Those are the most popular areas that we are going to see. Now, what I will say is that you want to make sure that you're being as consistent as possible. We've already kind of talked about that, right? You want to make sure that when you're doing those sites, you are always going for accuracy. Don't pull too hard, don't pull too loose, right? But the two that are probably the most important are your client's waist measurement, taken at the narrowest part of the waist. And if there is no narrow part, then it's their belly button. And their hip measurement taken at the widest part of the hip. So narrowest part of the waist versus the widest part of the hips. The reason that is so important is because one of the other statistics we look at is what's called the waist to hip ratio. We know that abdominal fat in particular is the most dangerous in terms of causing cardiorespiratory disease and things like that. So we want to make sure that we are measuring our client's waist to hip ratio because it can tell us if they are at increased risk of disease based on their body shape, right? So like they might be a little bit more apple shaped, they might be a little bit more pear shaped, right? Apple shaped obesity tends to be more dangerous. We think that it's because that's where all of our vital organs are. So we're pretty sure that's probably the cause, but we don't really 100% understand this. We just know that this is typically associated with those diseases that we're worried about: cardiorespiratory disease, metabolic syndrome, diabetes, things like that. So we pay attention to that waist to hip ratio because if it falls outside of those normal ranges, remember, I've said this before, if your BMI is outside of normal ranges, that doesn't necessarily directly translate to you being unhealthy. But if your BMI is outside of normal ranges and your waist to hip ratio is outside of normal ranges and you've got extended bifat, right? Like the more things we're checking off, the more at risk we are. So this is just one more statistic that we're sort of looking at there. So let's say I measure my client's waist and it is 39 inches, right? And then I measure my client's hips and it's 43 inches, right? So I would say 39 divided by 43. That gives me a waist to hip ratio of 0.906. So we're going to say that's a ratio of 0.91. Now, if my client is a male client, that's actually fine. That's a normal waist to hip ratio, right? If my client's a female, though, that actually falls outside of normal ranges, and that's putting them at a higher risk category. So we want that number to be 0.8 or lower for our female clients, and we want it to be 0.95 or lower for our male clients. I know that seems a little weird, different numbers for the two sexes, but the reason why is because women have a wider pelvis, and that wider pelvis means that we need to adjust the formula. If we look at like a male versus female pelvis, either my internet can hear me or it knew where I was going with that. But you can even see like this is just a much wider area here. So the female pelvic bone means that we have to have a different formula because the hips are naturally going to be wider. And then lastly, our final sort of body composition bit here, which isn't found here actually. Where do they put this on this? They moved all this stuff around. Oh, it's on the lifestyle and health history. So we've got their height and we've got their weight. We would probably list BMI. Now I will say, you'll notice NASM has kind of put BMI over here. Oh, never mind. It is here. Never mind. They took it off on one of the other forms. They must have put it back on. Like I said, BMI to me, not the most important thing to track in the world. I think it's sort of been misinterpreted as like a health indicator. And it is if there's a lot of other stuff going on. But again, it's your weight in kilograms divided by your height in meters squared. And that'll tell us body mass index. Ideally, that's somewhere between 18.5 and 24.9. If it's above 25, that's overweight. If it's above 30, that's obese. If it's below 18.5, that's underweight. So we're just going to take a look at that. All right, that's the body composition stuff. Any questions there, guys? Questions on body composition? Body fat testing, skin fold calipers, anything like that? Cool. All right, let's look at cardio assessments. So cardiorespiratory assessments, there's going to be two main ones, but there's other ones out there as well. In fact, actually, NASM's been adding, they put some new ones up here. The 1.5 mile run, that one's actually really simple. That's like, hey, run 1.5 miles. How fast did you run it? What was your heart rate at the end? You know, and we're just going to track it and see if it gets better. We're not really comparing that too much to anybody else. But I love that one. I think it's great. It's literally just a good way to be like, are you faster? You know? And then we have the Vt1 Vt2 Talk Test. This is kind of a cool one, but basically you're going to put your client on like a treadmill and you are going to continually make it harder until eventually they get to Vt1. You make it harder basically every minute on the minute until eventually they get to where they start breathing hard. And they say, okay, now I'm starting to breathe hard, right? They're not out of breath, but they are officially like, they feel like, okay, exercise has begun for me. And you're going to base it subjectively on how they feel. And you're like, great, that took us X number of minutes, right? So you write that down. And your heart rate is currently, and then you measure it. And now you have a low range for where exercise begins. And then you take them to the place where they're officially uncomfortable trying to talk and breathe at the same time. So they are just barely out of breath. I wouldn't consider it out of breath. To me, that's VT3. But I would consider it like, okay, this is uncomfortable now, right? And then we measure our heart rate there. And now we've got a zone that we can work between. And that's a really cool test that hasn't been in the textbook for years. But I really like that one because it's kind of just like, it's based on how hard you can push yourself, So if I put Danny and Cyrus, put you guys both on a treadmill simultaneously and just made it harder, 1 mile per hour faster every minute on the minute, right? You guys are going to get to your VT1s at a different time, but maybe similar heart rates, and then maybe your VT or maybe your VT1s are totally different from one another, It's just going to kind of be based on whatever however my client feels, But generally, the one that we're going to recommend the most with senior clients is going to be the Rockport walk test. So the Rockport walk test is a 1 mile walk where you walk as fast as possible, and it's going to help us estimate our client's VO2 max. So they walk 1 mile as hard as they can, as fast as they can, and we're going to measure all their statistics at the end. So again, if I go to a Rockport walk test calculator and I punch in all this information, let's say my client is female, 65 years old, 190 pounds, and their heart rate at the end of 1 mile was, let's say 104, that's a lot. Let's say like 130, and it took us 15 minutes and 12 seconds to complete. I hit calculate here. She did pretty well, pretty fair on the score, not bad. Put her in the green zone. So I go back to my little thing here, and I would say it took 14 minutes. How long did I say? 15 minutes and 12 seconds. So 15, 12. Their heart rate at the end was 130. And so I'd put them in the fair category. It's pretty good. It's not bad. It's not great, but it's not terrible, right? So then let's say we do it a couple weeks later. I'm making sure I'm being gentle here because she landed in the fair category. You can see that puts us in zone 1, right? That's very orange, right? So zone 1 instead of zone 2 instead of zone 3, right? So they're going to qualify for zone 1. So I work with them in zone 1 for a couple weeks. They get better at it, right? They come back, they finish it, they knock a whole minute off, 14 minutes, and their heart rate's a little bit lower. And maybe they've lost 5 pounds. I hit calculate, boom, they fall into the average category. Workout's the same, average is still very much zone 1, but I'm just about to break into zone 2. So again, another 30 days, let's say they get a little bit better, 122, we'll say 14 minutes and we'll say 0 seconds, 14 minutes on the dot, they lost another 5 pounds. Come on. Nope, still average. There we go. Eventually they make it into the good category, right? And now suddenly it's like, all right, guess what? We are amping it up. Let's do some interval training for the first time, So that's how I'm going to use this information. Now, I was totally doing this up here, but it's down here. Sorry. I totally switched up to Ymca without noticing. But poor, fair, average, above average, right? So I look at my book, it tells me like how well they did, or I could just use this calculator here. And it's just a very helpful assessment that, gauges my client, how well my client's doing with cardio. So I personally like the Rockport walk test with my senior clients because yes, it is a 1 mile walk, but that's pretty low impact. They can go at their own pace. I don't have to push them very hard. The disadvantage is it will take somewhere between like 15 and 20 minutes. That is a huge chunk of time. So if I know that I've got a senior, I probably won't do cardio assessments on the first session. I'll probably carve out 20 minutes of maybe our first workout later on. And that is what I'll often do with seniors. Now, if I've got an average everyday client, I might instead do what's called the Ymca step test, which is that test I talked about a couple weeks ago, where we have a client step for 3 minutes. You can see the protocol here on a 12-inch step. And I calculate what their heart rate recovers to, after 1 minute's time. Blah. Where's the freaking protocol? I had a really good one that I pulled up. There it is. So you can see all the rules here, right? So I make everybody do a 12-inch step. I make everybody go for 3 minutes, and I make everybody step at 96 beats per minute. Left, right, up, down, down, 1, 2, 3, 4, right? Like, and I do it for 3 straight minutes. And that way, everybody who's ever taken the test gets the same amount of stress. And then once I'm done, I count their recovery pulse, which means I have to count their pulse for 1 minute, and their heart rate's going to be like this. Eventually, it'll slow down. Faster it slows down, the lower the number is going to be when I'm at my end of 1 minute. So that tells me that they got in really good shape. So if their heart rate recovered to, let's say my 65-year-old female client here, their heart rate recovered to 120, well, that puts them right here below average. 4 weeks later, we do the test again. They recover this time to 110. Well, that puts them above average. That's a huge improvement. Let's say they're superhero. 4 weeks later, they recover and it's like 90. That puts them excellent. That's the fastest improving cardio I've ever seen. But hey, I'm tracking that. The advantage to this test is that it's only 3 minutes long. The disadvantage is it is relatively high impact. It's a 12-inch step up and down, 3 minutes straight. That might be intense for some clients. So depending on the client, that's, I'm going to choose my cardiorespiratory assessment. There's a lot of options on NASM's website, as you can see here, right? A lot of different options out there. Me personally, I've always done, whenever I can, I do the YMCA step test because it's so fast. And I think that's great. It's very efficient. However, there are plenty of times where I'll do Rockport walk because it's just a little less impactful. It's not going to leave my client debilitated the next day if they have like arthritis or something like that. You guys know the drill. Questions, comments, concerns. How you feeling about cardio assessments? By the way, we are going to practice these in a couple weeks.
Much better.
Cool.
No.
Yeah.
That was
All
easy.
Yeah, I know that one's, those are the easy ones. It's like step 1, do the test. Step 2, look in the book, and your book has all this, right? It has all the scores and what they mean and stuff. All right. Next one is what we've been talking a lot about over the last couple of weeks. Obviously, our last 3 meetups have all been kind of based around the overhead squat assessment and sort of identifying what that means and, how posture works. But just as a quick review, dynamic postural assessments are one of the quickest ways to identify your client's like status of how they can actually move, right? It helps us identify their length tension relationships. Remember, length tension relationship is the length of a muscle and how much tension it can generate. Obviously, if they have an altered length tension relationship, they've got that overactive muscle on one side of a joint and the underactive muscle on the other side of the joint. So we now know what it is that we want to stretch with the overactive stuff and what it is we want to strengthen with the underactive stuff. So we are going to have our client move through specific postural assessments, right? Now, we might start with a static assessment. Okay, if we go over here, we look at this assessment form here. You can see the static assessment. We're just going to look in 3 different places, right? Or I'm sorry, we're going to look for 3 different things, I should say. We're going to look at the anterior view for Planus syndrome, aka pronation distortion syndrome. That's going to look like this. Where we see our clients' knees cave in and feet flatten, right? So that's kind of what's happening here, right? You can see she's definitely like adducting. Look at her knees. They're not lining up with her toes, right? So she's in adduction, right? She's externally rotated the feet. She's got tibial external rotation there, and she's got ankle pronation. Her feet are flattening onto the floor. as well as hip internal rotation. So all of that is kind of happening simultaneously. We call that pes planus syndrome. And we would just circle that, right? It's like, hey, I see it. So I circle yes. Or maybe we see lower crossed syndrome, which would be that anterior pelvic tilt, right? Where we see the client, oh, that's upper cross syndrome, but I will open that for the next one. We see it right here, right? That anterior pelvic tilt, right? Posture with the exaggerated low back arch. There we go. Not this one over here, but this one right here, right? The exaggerated Instagram booty, right? Seeing way too much of that. If I see that, I'm going to mark it, right? Yes, on the lower cross syndrome. Or maybe they have upper cross syndrome, right? The rounded shoulders, the forward head posture, right? We're seeing the mastoid process not line up with the shoulders. We're not seeing the shoulders. I guess they are kind of line up with the hips, but still very rounded in the upper back there. Drawings are hard. So I'd circle that yes, right? And so we're going to see what that means. And if we don't see anything, well, great. Let's put them through the overhead squat, right? And in fact, let's put them through the overhead squat anyways. So the overhead squat, we're going to take a look from the anterior view and from the lateral view, and we're going to look at those 5 key kinetic chain checkpoints: foot and ankle complex, knee, lumbopelvic hip complex, shoulder, and cervical spine, right? So we're going to look at those 5 key places, and we're going to look for deviations there, right? So we're going to have our client stand with feet shoulder width apart, toes pointed forward. I know I've said in the past, I don't mind a toe turnout if they're barbell squatting, but that's a specific exercise. This is a posture assessment. So I want toes forward, arms overhead, and I'm going to have my client squat to chair height. Okay, about 5 times. You know, me personally, I do more than that. And I'm going to look to see any of these compensations listed, right? Do their feet turn out? I go over here. I'm looking at the left foot. I'm looking at the right foot. Yes or no, right? Do the feet flatten? Yes or no? Do the heels rise? Yes or no? Do the knees cave in? Do the knees cave out? Do they have an excessive forward lean? Now, I will say I'm adding some in here because we've talked about them in our classes. For instance, feet flatten, heels rise, knees cave out, low back round. I'll put all of these in purple. These are all the ones that will show up in capstone. In the regular assessment, in the regular book, you're just looking, do the feet turn out, do the knees cave in, do they excessively lean forward. Those are the 3 we talked about last week. This week. Those are the ones we talked about on, when do we meet? Tuesday? Those are the 3 we looked at on Tuesday. When we meet next week, we're gonna be looking at low back arch, arms fall forward, and forward head posture, right? So those are sort of the big ones that we'll see there. And they're gonna mean certain things. Now, let's say my client kills it. They crush on the overhead squat. Now I wanna make it a little bit harder. Well, guess what? I can put them through the single leg squat assessment, right? It's the exact same thing, except now I'm going to look to see, do the knees cave in here, right? And if it does, this is actually pretty good alignment, right? He's level. That is a knee caving in, right? So if they squat and their knee caves in like crazy, it tells me the same thing. It tells me that their glutes are underactive and that their adductors are squeezing too hard. Or I'm going to look at the pushing and pulling assessment, right? Do the shoulders elevate? Do they have the forward head posture? Do they arch the low back, right? And if they do any of those things, I go down here and I take a look at what it means, right? Let's say I marked my client for pronation distortion syndrome earlier, right? Tight muscles, weak muscles, AKA stretch them, strengthen them, right? What if my client's foot turns out? Overactive soleus, gastrocnemius, hamstrings, right? Underactive, anterior and posterior tib, glutes. So it's got all my answers for me. Shows me what muscles to pick. Now, I know exactly what muscles I'm going to prioritize strengthening when I write their program next, okay? So that's our overhead squat. Obviously, I'm not breaking all those down today. We've been breaking them down in our workshops lately. And we will be taking a look at them more in the assessments course that takes place, our 12-day class coming up at the end of this one. But that's sort of how we approach the overhead squat and all those posture assessments. Posture assessments are used for me to look at this sheet and then tell what's overactive and underactive. If I see my client's arms fall forward, I know that their lats are tight and their teres major and their pecs are really tight. All of those muscles that are sort of pulling the arms down. So I need to stretch that out. I need to do a lat stretch. I need to do a pec stretch, pec minor stretch, right? And a teres major stretch. I need the external rotation, right? And then I need to strengthen their middle trapezius. So I'm going to get that through rows, right? I need to strengthen their lower trapezius. I'm also going to get that through rows, but I'm probably going to do maybe a low row, right? I need to get their rhomboids, again, rows, right? And I'm going to get their posterior deltoid, maybe like a reverse fly. And I need to get their rotator cuff. So external rotations. If I do all that, it's going to fix the arms fall forward, right? So there's my list of exercises to prioritize. A lot of upper back work, right? And there's my exercises to stretch and foam roll. Lastly, this is a special one for our senior clients only. Well, I mean, it can be for senior clients. So you can do it with anybody. It's safe for anybody, but the timed up and go assessment. We are going to practice this next time just because I think it's fun. I know it doesn't have anything to do with posture, but it's really fun to watch adults do this assessment because they get really competitive. But the timed up and go test. Here's a little video
my career
that's going to break
into
this
personal
down.
Training. NASM was the perfect choice and a great transition.
Because I personally
We already bought it.
In this video,
I get so many freaking NASA ads, like all day, just NASA ad. It's the only thing that's before my YouTube. All right, here we go.
we're going to be looking at the timed up and go test to assess fall risk in the elderly population.
Criminy.
Hi and welcome back to Physio Tutors. The timed up and go test has been rated both 87% sensitive and specific in identifying elderly who are at risk of falls in a small-scale study done by Shumway Cook et al. In the year 2000. To conduct the test, you need a chair, a stopwatch, and some tape to mark a line on the ground 3 meters away from the chair. To conduct the test, have your patient sit on a chair with possible walking aids at hand. Then explain the procedure to your patient as follows. When I ask you to start, please get up from your chair and walk at a comfortable and safe pace to the mark 3 meters away from you. Cross the line, turn around and return to your chair and sit back down again. Could you repeat that to me? If your patient has understood the process, ask the patient to start the test. Once you ask the patient to start the test, you will start the stopwatch and only stop it until the patient is seated again. Okay, Kai, you may start. The patient
There we go. That's the entire assessment. I know it's not the most athletic assessment in the world. For the record, there is a slight difference here as well. He has him just walk past the tape and turn around. NASM is going to instruct you to place like a cone or an object of some type. You want to have them walk around that. But basically, this is how long it takes them to get up from a chair, walk around an object that's 3 meters away, and sit back down. You're going to measure how long it takes on day one, and you're going to measure how long it takes, and you're going to look to see, does that time improve? And it sort of shows us that the program we wrote is improving their agility and their total body strength. So it's just an opportunity to kind of get them up and moving and see how well they do that. And we just look for improvements over time. But it does have to be a walk. Yeah, it's basically just there, there's no score that they have to hit. Like I know that we looked at sort of norms today. Like we looked at like, well, this is how the knees are supposed to move, or this is what the heart rate should have been, or this is what the race tape ratio is, right? That's not how this test works. This test is just them versus future them. Okay. So we're just looking for improvements over time. We'll practice this at Sochi, and it's really fun actually. It's just like really fun to like see a bunch of like adults like walk as fast as they can and like sit back down. So that's a fall risk assessment. If they get slower, they're increasing their risk of being in a fall. You know, if their time is very slow, if they're not very agile. So yeah, those are all of our assessments. Like I said, we got the subjective stuff. That's all the immeasurable data, that's still very valuable. It's the why behind the what, and the what is all the objective data. What is their heart rate? What is their blood pressure? What's their, how well did their cardio recover after a specific amount of stress? What's their posture look like? Are they, quick and agile, or, maybe they need to work on their agility a little bit. And that is really all of the assessments that are not only in your regular textbook, but we got a couple extra ones in there from the senior stuff. I will say we missed performance assessments. We didn't cover any of those today. So like agility assessments, strength assessments, like 1 rep max testing. We'll look more at that next mod because that stuff's not quite as relevant for senior clients. But for the most part, that's pretty much every assessment in your regular textbook. At least that's all the really important ones. Questions on that, guys? How y'all feeling?
Good.
All righty. So I know we're kind of at our normal time. I got one more chapter to get through here. The exercise safety guidelines approach. It's very short. It's literally 9 slides. One of them's a summary. One of them is an intro slide. So this chapter is how to, just some things to remember before you actually start working out. It's like, we're sort of looking at this as is sort of going in order of like, training a client. It's like you get your assessment data. Now, before you train them, make sure you're keeping them safe. Here's things to remember about as we get older. So this is guidance for leading an exercise program, specifically the physiologic considerations we have to make, like when someone gets older, right? So first one, vision impairments. As we get older, our eyesight starts to go, our vision sort of declines with age. We'll see a decrease in visual acuity. That means just a general blurriness. We'll also see sometimes seniors will struggle with like farsightedness. Like I'm nearsighted, I see pretty easily close, but I actually have a hard time seeing stuff far away. Seniors kind of get the opposite of that. They'll sometimes like the lens will harden, and so they'll get farsightedness, and they'll have a hard time seeing up close. It's why if you've ever seen like somebody do this thing where they're reading and they kind of lean their head back, that's somebody who's farsighted. That's why seniors will wear bifocals, because then they can like use the lens for looking far away, and they'll use the lens for looking up close for different purposes. So that is a loss of lens flexibility, and so they're just having a hard time seeing. Also, when we get older, our color perception kind of changes. Contrast becomes an issue. So like, honestly, the notes up on the screen right now would be kind of hard to read. It actually might help. I mean, this would be even worse, but actually, I guess this would be even worse, because it's like purple and black just aren't that different from one another. So instead, it might actually be easier for a senior to read something like this. Oh, it's not still highlighted. Black text or black background with white text is a little bit easier to read than white background with black text. Do you need to do that? I don't know. It depends on your client. Honestly, you'll probably be fine if you just put it in bold. So be aware of like those color perception changes, and then adjustment time. This is actually one that I've seen plenty of times working with clients. When I worked at an LA Fitness, there were like dark areas to the gym, and then like a super bright area where like the upper back machines were, like the lat pull down and the rowing machine and stuff. So I always had to be cautious. It takes a little longer to adjust when we get older. You know, the eyes dilating and stuff. So just take a second to like pause. If you're moving from like a really bright area to a really dark area or vice versa, just give it time. Just give your client a little bit of time to adjust when you're doing that. So again, safety recommendations, use large print, use high contrast images. Oh, and be aware, don't stand in front of bright light sources. Like I said, when I worked at this LA Fitness, it's the one that looked over the 101. You guys know that one in Universal City. It has this like big circular area where it put like all the pull up and lat pull down machines, which was cool looking and cool in theory. But if I was like coaching my client and I like stood in front of those windows, I was a morning trainer. So the light would be coming in like right at that time. So my client like straight up couldn't see me. So if I was like trying to demo and show them how to do something, they couldn't see. So just be aware of that. You know, I don't know how long it was until I finally noticed that one day, you know, but eventually I just flipped it around, you know, and I would stand and I'd be blind. I'd be like, so you're going to go like this, you know, like, and that way my client could see what I was doing. And then just give your client time to transition when you're moving between rooms, like I said. Hearing changes when we get older, we do experience changes with we have difficulty with certain frequencies. Alyssa and Marjan, I'm going to call you guys out in particular because you've got a little bit more of an uphill battle than the rest of us in this call. When we get older, it sometimes becomes harder to hear at certain frequencies. Your voices are probably a little bit higher pitched than some of the male people in this room. Women tend to have a slightly higher pitched voice, which means it's vibrating, the air frequency is vibrating a little higher, and that is actually harder to hear for older clients. And I've told this to every female student I've ever had, and I've worked with female trainers, and they will tell you this is true. Speaking in your slightly like lower register, so just dropping your voice. I'm not saying you got to do something like this, but speaking a little bit at a lower register instead of like a higher pitch can sometimes make it a little easier for your voice to carry across further distances. Talk to any female trainer and they will tell you that it is easier for their group exercise classes to hear. You just learn how to kind of speak in that lower register instead of a higher one. It can actually make things a little easier. I know it's a weird one. It's just a unfortunate side effect of physics. There's also conductive hearing loss, which just means that like that's just general hearing loss due to like, you know, impact over time. And then there is also a little bit of sensory neural hearing loss as well. This is a sensitivity to certain frequencies that we want to be aware of. So if your client has like a hearing aid, for instance, certain frequencies can like set it off and it's just like very painful. That's not going to be your voice, but that can be like the clanging of machines sometimes, like if a plate hits really hard. Again, one more reason to not drop your weights in the gym. Sorry. But that can be really painful for certain senior clients. So just be aware of that. Don't slam things around your senior clients. Don't slam things around any of your clients. But our recommendations, just be aware of these things. Always face your client when speaking. It does help when someone can read your lips a little bit. It makes it easier to be clear. Speak slowly and clearly. You don't need to shout. You don't need to be louder. If anything, that can actually make it harder sometimes. You just need to be clear. And then a lot of times, guys, just use a visual reference, you know, show your client what you're doing, give them a visual aid, demo for your client. You do that, it'll make it way easier for them to understand. And lastly, thermoregulation changes. You guys might remember when we talked about youths a couple weeks ago, we talked about how kids are terrible at regulating body temperature. Guess what? So are seniors. When we get older, we don't sweat quite as much, so we can overheat a little more quickly, but we also have poor circulation, so then we get cold really easily. So very different reasons. With kids, it was a body surface area problem. For seniors, it is literally an age problem. So make sure that you are watching for that. Also, a lot of times seniors will try to keep themselves warm. You know, these are adults who understand like to dress in layers, but just encourage your client to avoid baggy clothing. A lot of seniors will wear like sweatshirts and stuff, which is fine, but they'll wear like a baggy sweatshirt, and then it can get caught on a machine. They can get injured. They can pinch a finger or something. That's not going to be good. Also, make sure your client is wearing proper comfortable shoes. Again, we talked about poor circulation with diabetic clients. We don't want to get a blister, right? So proper socks, proper shoes, foot care is very important. And then also like ankle support if they need it. I think that one's less important, but you know, obviously it's a priority depending on who it is. Encourage that they're drinking water regularly so that they don't overheat. You may need to add some electrolytes in there if hydration is an issue. So, you know, smart water or alkaline water with, you know, hydrate, you know, whatever. But honestly, just water's fine. Dress in layers, but in those layers, make sure they're not, you know, wearing too baggy of clothing. And then, yeah, wear those comfortable shoes. And that's, I think it's like 3 pages. That's the entire chapter. Just be aware, vision changes as we get older, hearing changes as we get older, thermoregulation changes as we get older. And, you know, make those adjustments. Don't let your client dress too baggy, but do encourage them to dress in layers. And just keep your client safe, guys. That's it. That's the whole chapter. Any questions? How are y'all feeling? Simon, Cyrus, Danny, Alyssa, Marjan, how you guys doing?
Good.
Cool.
I think so. I'm good.
Love it.
I'm good, thank you.
All righty. Well, guys, we are wrapped up. It is the weekend. Let's go ahead and end it, and I'll see you on Monday.